Obviously, we've taken significant measures to keep Canadians safe, particularly given the threat of these new variants that are being developed or that are emerging elsewhere around the world.
What the hell did you just say?
We've taken significant measures to keep Canadians safe, particularly given the threat of these new variants that are being developed or that are emerging elsewhere around the world.
Oh my God.
And finally, a little bit about the National Guard. The federal government continues to take aggressive action and proactive steps to address the COVID-19 threat as we attack the health and safety, or protect the health and safety of the American people. As we attack the health and safety, or protect the health and safety of the American people.
She joins me now live. Thank you so much for joining us on BBC News. I wonder, Donna Kinnair, how do you feel about the government's plans to test all essential workers? Do you think that health workers should be given priority, or do you think that this is right?
We know that we haven't infected enough of the population with this virus.
We expect their conversation to be wide-ranging, to cover a range of topics of mutual interest, everything from COVID-19 and our efforts to address the global pandemic to regional security issues, which could include a range of topics, everything from COVID-19 and our efforts to address the global pandemic.
Just listen to what he says here.
We've always known that one of the things that has the potential to knock us off track would be a new variant. That's why we made...
What was that? Let's listen to him again.
That's why we made the presence of a new variant that could do that.
No doubt, this is a virus that has now shown us that it has a very strong capability of more efficiently spreading from person to person than the previous prototype viruses that we've experienced. From person to person than the previous prototype viruses that we've experienced.
So in a very minor collaboration as part of a subcontract of a grant, we had a collaboration with some Chinese scientists. We had a collaboration with some Chinese scientists.
Do you see a day coming in near term, medium term, when the number of deaths from COVID is going to be about what it is for the regular flu? Do you see that coming?
You know, I'm really encouraged with our case rates falling, but as you know, our death rates are too high. Here's what we know. We know that the people who are dying from this disease are 11-fold more likely to pass if they are unvaccinated. Here's what we know. We know that the people who are dying from this disease.
Using every lever of government to reduce sicknesses, to reduce hospitalizations, to protect more people, to protect more people, to protect more people.
Social distancing works by denying the vaccine the social contact that it needs to spread.
Yes, of course, the vaccine, the therapeutics, which aren't much talked about, but the drugs that help take some of the fatalities, the fatalities out of those.
It's now 1B. 1B are our most critical people. So they are our older people, 70 years of age and older. We know they are just so vulnerable to getting ill and dying from this vaccine.
An Australian biotech company has developed a new treatment it hopes will prevent people dying from COVID vaccine. It hopes will prevent people dying from COVID vaccine.
You know, while these vaccines might be new, the technology behind them really isn't new at all. You know, scientists have been studying similar viruses and working on this type of vaccine for decades, and many of you probably already know this. So when this pandemic started, they already had a pandemic ready to go. So when this pandemic started, they already had a pandemic ready to go.
We understand how important it is to eradicate the virus at home and everywhere at the same time.
That's why Canada's moved forward in a number of different ways to ensure that wherever and whenever a virus is developed, we make sure we're maximizing our chances to be able to obtain it. Wherever and whenever a virus is developed.
Well, now we're joined by Professor Sir John Bell, who's the Regis Professor of Medicine at Oxford University and is part of the team developing a coronavirus vaccine. And finally, Sir John, the question everybody's asking you, when? When will it be? When can I have one?
Yeah, so as you may have spotted, there's a wide range of views on this subject. But then don't forget, these vaccines are unlikely to completely sterilize a population. They're very likely to have an effect which works in a percentage, say 60 or 70%. We'll have to look quite carefully, and the regulators will have to look quite carefully to make sure that it's done what we need it to do before it gets approved. So there will be a delay between the outcome of the trial and a decision whether it can be approved as a vaccine. And of course, anything that happens...
Professor Sir John Bell. I'm sorry, I didn't mean to cut you right off like that.
Can I just say that anything that happens to undermine the legitimacy of regulators to make independent decisions is, in my view, profoundly unhelpful.
Professor Sir John Bell, thank you very much indeed for joining us.